Welcome, everyone. This is Inside the Canna Industry. We are blessed to be joined by Dr. Victoria Starr and Kareem Abdalla. So I'm going to hand it on over to Dr. Christine Roussel. She's going to take over this session, and we're going to learn more about different roles for pharmacists in the cannabis space.
All right. Good morning, good evening, everybody. Thank you so much for joining us. I think it's a great opportunity to hear about different careers in the industry. And my power just went out my house, sidebar. So one of the most common things that I hear about education when doing education is, what are the opportunities for jobs in the industry? So we can start. I'd like to hear about all the different types of roles pharmacists take, everything from drug development to direct patient care to even testing. So I wonder if somebody could go first and give us a couple minute discussion about what your job entails, and also what prompted you to get involved with the industry. Okay, so Victoria, let's start. What brought you to the cannabis industry? And talk to us a little bit about your job and what kind of made you choose that role.
Well, I wear many hats. And first I'll say a little bit about my journey to cannabis and getting into the industry. And it was due to my own health problems that I had and my frustration with what was available. I was diagnosed with chronic Lyme disease 5 years ago, and it affected my heart and created a lot of pain. Chronic pericarditis is a very painful condition, and it basically just it ruined my life for a couple of years. And around that time is when cannabis became legal in the state of Oregon. And so I started doing some exploration in terms of determining whether I could find a way to treat some of the pain that I had and not rely on some of the medications, the opioids that were being prescribed to me. You know, I was not interested in taking those medicines, and I wanted an alternative. So once I figured out what worked for me, I realized that there was a lot of people around me that were interested in hearing what my experience was. And as it turns out, there was a local company in Portland, Oregon, that was looking for people to work for them and in different realms. And I went to speak to them because I was interested in doing like an investment and getting involved in advocacy, but I didn't really think that they were going to hire me. And after I spoke with the CEO of this company, and the company was basically getting involved in creating healthy food and beverages and looking at medicinal uses of cannabis for a variety of different conditions. And as soon as I told them my story and where I came from, they hired me. So I started working for this company as an advocate in cannabis, and also doing education and working with other healthcare professionals in the Portland area that are aligned with using cannabis. And I also started doing some formulation with some of their companies that came in and looking for what specific ratios and terpenes we could put into products to make them really work and be good products for people to buy. And then at some point, I realized that my work with clients, that I really love working with clients, and that's what my dream is to still work with patients. And I started my own consulting business on the side just this last year, and people from all over the country, they call me and get advice on how they can use cannabis as medication. And spent a long time getting that website up and running and putting together information for people and creating protocols and totally holding their hand the whole way, and where they're going to buy the medication, how they're going to dose it, how they're going to keep track of what works. And it's been really, really lovely. So I've kind of got my hands all over it. And it's been a long journey, but it's been fantastic.
I think that is one of the most inspiring stories and things that I've heard before, where healthcare providers have sought cannabis for managing their own medical conditions, and then it takes on that whole entire approach of wanting to pay it forward and help other patients. And that certainly, really helps you better identify with the patients and be more effective in your job. So I think that's a pretty amazing story.
It definitely does. And I think too, I ended up getting diagnosed with cancer a year ago. Once you start throw cancer into the mix and you tell people about every single time that I could use cannabis in many different ways while I was going through cancer treatment, that even raised the awareness up again. So I feel like every time I'm tackling a medical problem, which unfortunately I've had quite a few in the last 5 years, I've been able to have such great success. And I just want to share that with other people. And people really have found a lot of hope with it too. So it's been very satisfaction. It makes you feel really good to know that you're helping people. The satisfaction quota is just out the roof. It's so awesome.
That's amazing. I'm a board certified oncology pharmacist, so I know through my own experience that cannabis can really do so much for symptomatic management for patients. And in general, I mean, you mentioned other autoimmune disorders and cannabis symptomatic relief, but definitely disease modulation, which we don't know enough about to really speak about in terms of efficacy, really is exciting. Right. Do you have any, any specific patient stories, and you don't have to go into detail about dosing, that really help you feel connected and really make a huge difference in somebody's life? And I'm sure you actually have a lot of stories.
Oh yeah, I've got a ton of stories. You mean about other clients and about success stories with them?
Yes, and patients that you've had really meaningful interventions.
Oh yes. I've had, there's so many. The first one that I can think of is a 12-year-old boy that had Lyme disease that actually became cerebral, and he developed seizures with Lyme disease, and it was so bad that they had to pull him out of school and homeschool him. And the mom had heard about CBD, using CBD for his seizures, and was using it, but just wasn't using the appropriate doses. And so she got in touch with me, and I found a product for her to use with her son, and they started him on it. And a month later, she sent me a message and said that the seizures completely stopped within a week of using the CBD. And the next month, she called me back and said that he was celebrating his 13th birthday party. He was actually having a party for the first time in, I think, 5 years for his birthday, and was able to enjoy a party with friends and have like a normal birthday. And she called and sent me a message right away to just thank me for it. So, I mean, some of these ailments are so, they ruin people's lives. And when you can turn it around like that, it's just, it's a miracle. It is a miracle medicine for them. I know it doesn't work like that for everybody all the time, and sometimes it takes a lot more tinkering. But for that kid, it was almost immediate response.
That's amazing. So just kind of touching again, you've had different opportunities from direct patient care to working with grower processors, and even as we look now, there's opportunities for pharmacists and pharma. Let's switch to the other pharmacists, but when we come back, I really want to hear your perspective on what are future opportunities for pharmacists in the future. But will the other pharmacist introduce himself?
Hi, my name is Kareem Abdalla, and I'm from the Boston, Massachusetts area, and I'm also involved with patient consultations, so like clinical patient consultations, basically doing, more or less medication therapy management, but with the addition of cannabis as well, and seeing how that plays a role with patients' medications and their conditions, and things similar to Dr. Starr as well. And so as far as getting into this role, so it basically had a lot to do with a friend of mine. So I work at Dana-Farber Cancer Institute up in Boston, and one of my colleagues found out that her young daughter actually was diagnosed with stage 4 neuroblastoma, and she had, been scouring the web for everything that she could do for her daughter, and her daughter ended up going through chemotherapy and radiation and even surgical resection of some of the tumor burden. But even that was still not enough to really kind of alleviate all of her symptoms. She still ended up having significant pain, was having issues with sleep, appetite, overall energy levels. And just, it was very difficult for me to just sit by and like watch her struggle with this and see that there's you know, no real information that she's able to get her hands on, and she doesn't know how to dose this in her young baby, you know. And just hearing her talk about it was very, very devastating. So it encouraged me. It definitely lit a fire and, you know, fueled me to pursue, how do I help this woman? How do I help her? How do I help her daughter? How do I figure out how to fill this gap? And there's very, very clearly a big gap. And that's where all of us come in. That's where we need to step in and be able to fill that void, right? So providers might be a little hesitant to provide certain pieces of information, or they might just not know. They have a DEA license, so they're concerned about that. For us, I feel like we're kind of positioned in a place where we're licensed by our state boards, and we might have a little bit more flexibility or leeway when it comes to some of the concerns related to the federal legal status of cannabis. But that experience with this little girl was definitely huge. And she ended up starting both the THC and CBD combination, and eventually with time, her pain medications were reduced, her nausea medications were reduced, her energy and her appetite were improved, her sleep was improved, and her pain had been reduced. And it was actually amazing to see, like her mother initially was just like, I just want my baby back. Like, I want my little girl back. And like, I actually just went to the museum with this little girl, my little girl, and, you know, both of our families just this past weekend, and just seeing her run around, it's mind blowing. It's actually incredible to see like she's back, she's herself again. So that was, it's the most rewarding thing. And like Dr. Starr is saying, it's like, you can't describe, like there are no amount of words that can describe how satisfying that feeling is. So yeah, definitely an incredible experience. And that was the reason why I was like, okay, you know, I don't want to see other people going through those experiences and having to just Google things and hope that they stumble upon the right thing, especially when you're talking about, you know, your baby, your 3-year-old child. You don't want to be, you know, guessing with that. You ideally should be working hand in hand with a healthcare professional and figuring it out together, right? Like, not feeling like you're lost in this place and you just need to guess and check and hope that something actually hits and sticks, you know? So that was definitely a huge motivation, and especially seeing that turnaround in her, where it's like, okay, who else is out there? Who else can we provide clear, concise information to with a healthcare background, you know, and actually having that information. And then on top of that, I personally also ended up going through some challenges from a medical standpoint, which opened up my eyes to the impact cannabis has. And for that reason, like, that was another just layer of motivation for me to say, okay, you know, again, here's a pharmacist. We're positioned perfectly to be able, we have that access to our patients, right? We're in a place where also we might not maybe have the same legal ramifications that a provider would, but you know, it's definitely still a touch and go space. But it's one of those things where I feel like it's almost like it's our duty, right, to step forward and to help. And at the end of the day, cannabis is medicine, right? So it's our jobs to be, you know, knowledgeable in all medicine, right? And to be able to provide feedback and insight into all different types of medicine, whether it comes as a flower or it comes in a pill bottle, right?
So Kareem, tell me, so your story is certainly inspiring, and patient care is always something that makes a difference. Can you start with what your previous jobs were and how you ended up choosing to take that turn towards cannabis?
Yeah, so my previously, like, I'm still in a very similar role at Dana-Farber right now. So I actually work as an informatics pharmacist, and So I do a lot with like data and systems and things like that. And what I'm hoping to do eventually is actually bring that to the cannabis space. So to actually, especially since there isn't like a significant body of strong data, it'd be interesting to see if we can pull data in kind of innovative ways. So that's what I'm hoping to eventually do, is to marry the passion for cannabis and clinical consultations with the data side of it, and try and provide additional strength to some of the claims that we're trying to make. So I'm currently in that position as well. And it was about July of last year that I formally established the patient consultation business. And that, again, was the result of my experience with this particular patient.
Very cool. So, Kareem, I remember you saying that you had some challenges before opening up your PLLC. Do you want to go into a little bit more detail about that, if you feel comfortable?
Yeah, for sure. So when I was going through the process in Massachusetts to register my business, I had initially submitted the business entity as an LLC, so a limited liability corporation, which is a pass-through entity for you business folk out there. But what I ended up discovering is that because I hold a professional license and I'm planning to use that professional license in that business capacity, that I needed a professional LLC. So in order to do that, I needed to get sign off from the State Board of Pharmacy. So that's what I did, is I ended up having to reach out to them, and it was a long and arduous process, but at the end of the day, it took, about 3.5 months start to finish to actually go from, filing the paperwork, the back and forth through the emails with the Board of Pharmacy, with the Secretary of State, with, whoever, just to get everything situated. But it ended up working out, right? So I was very transparent. Here's what I'm looking to do. This is the space that I'm interested in. I'm using my license as I would or should, it's cannabis is medicine, where that's our job, right? So the board was understanding. They ended up providing that information back to the state, and the state allowed for me to be registered as a PLLC.
Wow.
I love it. So Victoria, back to you. So
I did not register as a PLLC, so that was not the way I went with my lawyer. He told me I could just do an LLC, so now I'm reconsidering what I should have done. But that's really amazing, because that's really putting yourself out there when you think about it. It means that the Board of Pharmacy knows exactly what you're up to, and it could be a little bit scary for us, right? When we start putting ourselves out there as professionals that are in a little bit of a gray area, just as far as cannabis is not federally legal yet. And I think that's awesome.
Thank you. And I agree. Yeah. I think it's definitely, it's one of those things where, and I feel like, Dr. Kane, this was one of our first conversations. I feel like we almost need to be willing to put a face with this, you know what I mean? Like, and I had done an interview for Boston Magazine a while back, and they'd asked me, and they were just like, hey, do you want us to, give you some kind of alias or whatever? And basically I told them, I was like, no, like I want to stand by this. I want it to be public. I want it to be known that, hey, we're in this, we're advocating for our patients, we're advocating for the proper use of cannabis. There's nothing to be ashamed about. Why are we hiding behind, just the legality of it at a federal level? If we know in our heart of hearts that this is appropriate, this is medicine, and hopefully eventually it'll be seen that way on a federal level, then there's no reason to hide, right?
Definitely.
And I do find it interesting that, both of you are in absolutely recreationally available states where, and correct me if I'm wrong, I don't know if either of your states have robust medical programs anymore since, you just have to be 21 to come in.
Not in Oregon. It's not robust anymore.
Which is unfortunate, and I think when advocates advocate for accessibility and, improving access to patients wherever they may be, and getting rid of qualifying conditions and whatnot, and adopting a recreational or adult use program, it really takes a toll on the medical patients, specifically our kids, our kids who may not be able to enter the regular recreational side, the elderly who may not want to go into that dispensary type setting. I know in my perfect world, we would be able to have cannabis in the pharmacy, like behind the counter. And so if you needed to speak, you had that as an option. But I think our community or our retail pharmacists are just so overwhelmed, and they have different measures that they're going by, which makes it tough. So being able to provide that consultation, that one-on-one, it really is the original druggist or the original pharmacist. Would either of you feel comfortable discussing your business model for accepting payments? I know this is a question I probably get weekly, and I wonder if you guys would feel comfortable sharing about that.
I don't mind sharing. I do PayPal. I tried using other places, and they booted me out right away. They banned me. So so far, all I use is PayPal. Every once in a while, I'll have somebody that's, because I do a sliding scale, I have someone that really can't afford to spend the money, and they'll send me a check once in a while. But for the most part, it's PayPal.
Yep, that's basically the same for me. And I'll be honest with you, I've been doing probably more pro bono than not, maybe more than I should.
Yeah.
So that's something I think is definitely a little bit of a challenge, because again, it's our roles, like it's in our nature. We want to help people. So sometimes things are formal consultations and there are payments. Sometimes it's just providing, friendly advice, or, so sometimes it's not as structured from a payment standpoint, but, and it's also up to you to figure out how you want to design your services. So for me, if you're only interested in cannabis related consultations, then my fee is going to be smaller. If you're interested in more of like an MTM style, entire medication review, entire medical history, if you have labs, things like that, a much more comprehensive review, in addition to how cannabis would tie in with all those things, then the fee changes, right? So it's up to you to kind of design your suite. And also I've, been thinking more about, okay, subscription models. If you have somebody who just is getting started, might want to subscribe to, being able to ask you a question or a couple questions, each month, and you have some kind of subscription model, they now have access to you. That's totally up to you too, right? So these are all different things that you can think about as you're trying to establish your own business, or if you end up joining somebody else's business.
Speaking of, that was a beautiful transition, Kareem. I want to talk about collaboration or partnering with other organizations. I know this is something that a lot of people struggle with getting started, where they want to be able to offer their services to a physician's office or a pain clinic, or even with a dispensary. Do either of you want to start that discussion?
I can start. I've got quite a few patients that have had doctors that had told them that they were comfortable with them exploring cannabis as an option. And so I do a lot of one-offs with those physicians that are cannabis friendly. And I've had a couple consultations with cancer patients, one of whom works at the Willamette Valley Cancer Center in Eugene, Oregon, and they want me to come down and do a talk for their providers on some of the things that I found useful in my own treatment for myself when I was going through radiation and cancer. And then I found a fantastic dispensary that's just around the corner for me. I did a talk with an advocacy group, and as it turns out, the owner of the dispensary, her dad's a pharmacist, and I'm going to meet with him tomorrow. But he made great efforts in creating a dispensary that was really friendly to people that have medical, concerns, and kind of looking at more at the medical cannabis as medicine than cannabis as a recreational drug. And so I'm hoping to do some more work with that dispensary. And they've been like sending people my way already in the last couple of weeks, and I've only met them like once or twice. But I think that they find that if there's a pharmacist out there that's going to help them make best use of what they have on their stock, in inventory, what works. And also they're going to have patients that are going to have better outcomes, and they're going to keep coming back. So they see it as a win-win for themselves. I see it as a win because I know that the patients are going to go to a clean, lovely space, that they can get time with the bud tender there, and that if need be, I can even meet them down there and help them out with something. But generally, I write a protocol that's it's really very specific. So they just have to go down there and pick up the medication, and that's it. And also they deliver in Oregon. So a lot of people can they don't even have to go to the dispensary. I can tell them exactly what they need, and they can pay $5 and have it delivered to their home. So they don't have to go in there, which is really nice.
God, that sounds amazing. Especially with the elderly, it's hard to shuffle,
Yeah.
in and out. That's awesome though. Kareem, what about yourself? Do you have any tips on partnering or collaborating?
My number one tip would be get outside of whatever building it is you're in. So like if you're used to operating at home or in whatever office or something like that, get out and go see people and talk to people. Like that's honestly, I think it's like one of the most important things, because email goes so far, phone calls go so far, but having like face-to-face sit down conversations with different people, I think it's the most effective. You can't beat it. And it shows people too that you care, you're willing to travel to go to see them and establish a relationship, and try not necessarily to have like a crazy agenda or motive, right? Like if you're just networking to network and hopefully something fruitful will come from it, then that's kind of the approach that I've found to be the most effective. Because I've messed around. I've tried, a very direct approach where it's like, hi, this is my name, this is who I am, I offer clinical consultations, do you have any interest in these services, right? And then I've also tried gentler approaches where it's just like, hey, I'm a pharmacist, I'm in this space, I don't know if you have any interest in this space, or it seems like you do. I just wanted to introduce myself and say, hey, and see if there's any opportunity for us to help one another in the future. And I found that approach ends up being more successful more often than not, versus a more direct approach. And that's just kind of been my experience, because I've reached out to all different kinds of places too, whether it's different boards, whether it's, local municipalities, whether it's school systems, even the school that I graduated from, and I happen to work with in a different capacity, one of the people down there. And I didn't even get a response from them. You know what I mean? So it's like, it's totally hit or miss. I find that like those face-to-face, genuine, personal conversations are the ones that end up being most successful.
I definitely agree with Kareem on that. And I also think that once you start establishing a pattern of success and people that really understand what you're doing and love working with you, that word of mouth is so strong that you end up getting a really great group of people surrounding you and supporting you. And it just kind of blossoms. It's really been an interesting thing to watch. You don't really need to push it on people, because the right people will find you. And they have in just a short period of time. I feel like I've got enough recommendations from other clients and telling their friends or family, and it's just slowly blossoming. It's I'm very great gratitude. I have huge gratitude for the whole process and how it's been working.
So let's talk a little bit more about product selection, product availability. Are there certain products that you refuse to recommend in your specific state? For example, I can't recommend for edibles in Minnesota, just as an example. And then the kind of part two for that is, how do you, and Victoria, I think I know what you're going to say, but do you guys actually say, go to this dispensary and buy this, this, and that? Or do you kind of make it more general for, liability purposes?
I'm very direct about a dose. I don't feel comfortable telling people to smoke a strain at this point. I know some people will probably argue with that, but I feel more comfortable giving a specific protocol with a specific dose, with a specific frequency, just like any other medication. And I just feel that that's the best way to track progress and to know what's going on and know exactly what people get. There's been a lot of question about whether the strains are consistent across the board. There's a lot of issues with that, you know, people not getting exactly the same strain each time. So I tend to go with pretty strict dosage regimens and terpene combinations and ratios for different conditions.
Yeah, and for me, I would second that, where it starts with your dose and what it is you're trying to accomplish by using cannabis. And then from there, asking the patient too, like, this is something else I'll do is, are they certified, first of all? And then second of all, do they regularly go to a dispensary? In Massachusetts, you can also grow. So that's something else that people might be growing their own medicine and just want to figure out how to use it appropriately. But yeah, it'll typically be like I haven't had an issue before going on different dispensaries' websites. They've actually come a long way in Massachusetts, where they have a lot of their menu online, which is very convenient because you can just hop right on and say, oh, okay, at this dispensary, they have blah, blah, blah for flower, for here are their edible selection, their oils, etc. And in Massachusetts, there aren't really any strong like regulations or restrictions regarding what you can provide. So like edibles are available, oils and concentrates are available, flowers available, vaporizers are available. So all different methods of consumption are available in Massachusetts. So for me, it's basically what's convenient for the patient. And then again, like Dr. Starr said, is, you know, talk about the dosing and have the standard pharmaceutical information, and then whatever just happens to be convenient for that patient based off of their geographic location, their mobility, things of that nature.
Very good. And I think that raises a good point. Like in Minnesota, we have a very controlled medical program. We only have 2 companies making products. So it's very easy to know what the other company has and what your company has and kind of just take it from there. So when you have, you know, 50 plus different manufacturers, people growing their own, it definitely makes it more difficult to control those variables. Do you guys ask or look for certificates of analysis? Like, do you actually look at the lab results from the products if you can?
A lot of them have them available now, right on the labeling in Washington and in Oregon. So you just try to go with the manufacturers that you know have been consistent and that consistently able to stock the product too, because for a while there's certain things that I really gravitated to and then they disappeared. The company went belly up, or they maybe had an issue and they disappear off the shelf, or they just can't keep up with the demand. If certain products are really good, they sell out. So there's always that problem that comes up. But it's good to see that there's a lot of companies that are stepping up and providing the lab data right there on the packaging, and I can see exactly what's going on. And there's just a few companies really that I've been gravitating to, so it's made it really easy to figure out what I'm going to use for people. I've kind of got a nice little network of companies that I've found that work and that people have an easy time dosing, you know, using the products as well.
Yeah, just as important. Absolutely.
Yeah, and for me, it's similar. I mean, from a labeling standpoint, like all of the labeling information will be available for any medical cannabis in Massachusetts with the, you know, specific cannabinoids and their quantities. As far as certificates of analyses, like that is something I have reviewed in the past, especially for me. I find it to be super important for CBD products, as odd as that might sound. And the reason why is because there's a increasing plethora of products out there, and there's very, very little quality control. Very little quality control, very little, and that's both from a product standpoint, like the actual substance itself, and then from a labeling standpoint. Like, you don't want somebody to misinterpret a label and then completely mess up dosing. But definitely from a quality standpoint too, because anybody nowadays, I mean, I go to the gym and all I'm seeing on, you know, during the entire time I'm there is like 16 different CBD commercials. Like, how many people are coming out with new CBD products and they're just flooding the market? Yeah. What's that?
I just get to see pharmaceutical drug ads.
Oh, yeah. Apparently my gym is interesting. But yeah, it's one of those things where like, yeah, I think if you have those certificates available to you, definitely take advantage. And those companies aren't going to hide, right? They're not going to hide them. They're going to have them out in the open. If you ask for them, they're not going to have a problem to furnish them. They want you to see that information. And as a matter of fact, if you have companies not willing to share that information, definitely walk away. And I would even take it a step further. So in Massachusetts, I think we only have about 3 different labs in the entire state that do testing for all the dispensaries. And I had a conversation with one of the owners of one of the labs. And oddly enough, he had said that people were actually going and they were falsifying his certificates. So they were taking certificates from other strains, from other companies, from other cultivators, basically swapping out their information and then presenting that. So all of these certificates actually have, there's a pedigree associated with them. So I would actually even experiment, right? So if you're becoming increasingly comfortable with a particular manufacturer or something like that, I would actually follow that chain and ensure that the pedigree of that product is in fact intact, right? So this is actually associated, with this certificate is in fact associated with this product, which I was, to be honest with you, wasn't something I had really thought of prior to this conversation with this lab owner, because I thought, certified stamp is, that's good to go, but people are apparently even abusing that in this space.
Which, brings us back to the whole reason we want regulated markets, is that we don't have this black market where we don't know what we're getting, we don't know where it's coming from, we don't know what effect it'll have. So, moving away from that, it's obviously the goal for any medical program, but it's great that we're able to provide that freedom, that constitutional freedom. I remember when I was at Patients at a Time, and I was up there it was like the discussion Q&A panel, whatever, and people asked me what I thought about home grows. And, there's my personal answer and then my professional answer. And it's hard for me to argue that, somebody can grow their own medicine and have it be consistent every single time and, get that reproducible result that we're looking for. And on the other hand, it's like, well, symptoms change. You might need different amounts at different times. But, as a personal liberty, it really makes me question why it's illegal in the first place. But let's see. Does anyone in our audience have any questions for our presenters?
Dr. Kidd, I'd actually like to touch up on that last point really quickly too.
Yes, considering you are in a grow state.
Yeah, exactly. So, and like, again, I just love being honest with people and just telling them like what my involvement is. So like me personally, I grow, and I have, had a great experience with it. It's been very, very rewarding. And it's been even challenging for me. Like I've been doing this for a couple of years now. I have many grows under my belt, and I'll be honest with you, it is a challenge to maintain consistency, even if you're talking about the same strain from the same, family or the same plant. There's definitely challenges when it comes to consistency, and even just effects and the predictability of those effects and stuff can definitely be a challenge for sure. And that's, me as a pharmacist and having done this for, many years at this point. So I definitely echo what Dr. Canna is saying regarding, some of those challenges. But at the same time, yeah, it can definitely be very fulfilling and rewarding to be able to say, yeah, I've grown my own medicine. And again, if you take it a step further, at least in Massachusetts, what you can do is actually send out your products for testing as a home cultivator. Like you don't need to be a dispensary or a business necessarily to actually get your product tested. So that's another liberty that we have in this state, which has been great.
I love it. So yeah, any of our participants have any questions for our presenters? And I should say, I believe you might be muted.
Do something about do you have a preference? Oh gosh.
Sorry about that. All right, so I think this was very informative. I know it's very difficult to go from behind the counter, behind the dispensing counter, and really go out there and, make a company and provide consultations to patients, especially when you don't have that buffer of, oh, I'm working under this clinic or this doctor or this and that. So being able to really own what we are doing as pharmacists, as drug experts, and providing clinical recommendations to patients, it's definitely the ideal vision that I see for cannabis. But ideally, we would all be aware, all of our pharmacists, regardless of their practice setting, would be familiar and understanding of the side effects and the drug interactions. Kareem or Victoria, do you have any tips or advice to any, I wrote new pharmacists, but I mean any pharmacist that's interested in transitioning to a role similar to what you're doing now? Any thoughts to that?
I would strongly suggest, which hopefully a majority of the people on the call, is to get involved in an organization like ISCPH. Like I'm saying that very, very genuinely. It's been awesome. And Dr. Kane's a badass and she does a fantastic job. She's wicked passionate in this space. And that's the type of person that you need to join forces with. And I can't say enough good things about her. And the fact that like she's lit a fire under my butt, you know what I mean? And she's really helped me make sure that, this isn't something that's just a phase or whatever. This is something like I hope to grow in this space, and I hope we all grow in this space more and more over the next however many decades. Like that's, and I do want to say, get involved with organizations like this. This has been huge. Reach out to Dr. Kane and see what it is you can do. Find out how you can get involved. There's a ton of stuff that can be done, and there's plenty of, like, we need as much help as possible in this space to actually be a part of it and also to help it advance. So that would be probably one of my top pieces of advice.
Kareem, you're very sweet. Thank you. And, this series is really showcasing what our wonderful members are doing and all the different roles that are available to pharmacists. There was one question here. Where are dispensary pharmacist jobs often posted online? So, sorry, I guess it was a private question, my bad, but I'm gonna send it to everyone. So I actually found my job just on Indeed. It's just a regular job searching website, but I do know that that would be one avenue, or dispensaries will post to their own websites. Do you two have any other recommendations for where to find dispensary pharmacist jobs?
Same thing, to be honest with you. My friend out in Jersey, so I'm in a state where pharmacists aren't required at the dispensaries, so we don't have any job offerings like that. But just based off of conversations I've had with people in neighboring states, it's been very similar, where it's some kind of generic job posting like Indeed or something like that.
Yeah, and in states that don't require a pharmacist, I think it's important to recognize that we're not limited to, working for a dispensary and pretending to be a bud tender, for example. We have the clinical autonomy, if you will, to provide reviews of medicines. And whether or not we're, physically writing a prescription, we're recommending or, providing a route to engage that conversation with another provider, ideally. So something else that stuck out to me, I was reached out to by a pharmacist who was working in a retail setting, and she had recommended CBD to some of her patients, and she said that she was fired for solicitation. And I see that it's a very clear conflict of interest, specifically because she was part of like a CBD MLM. So if you guys are not familiar, it's where like you basically get a percentage or a flat rate based on every product you sell. So just because there was that financial component, the CVS decided that that was indeed solicitation and a conflict of interest, and she lost her job. So I like to make it very clear for others who are interested in getting involved, speak to a lawyer. It's very important that you're able to protect yourself and your I'll say your profession and all the hard work you've done to get where you are. And it's, you know, it's terrifying to me to think that it could just be gone in a second. Now, yes. So somebody said, what happens to those pharmacists when the states go rec? Oh, you're saying pharmacists and dispensaries. I'm sorry. But another statement was that CVS sells CBD. And I will say yes, in certain states. I think in Oregon and Washington or so, Rite Aid can also sell CBD. But I know like in Minnesota, our Board of Pharmacy released a memo, and it said, unless this CBD is Epidiolex or directly obtained from one of the medical dispensaries, we only have 8, so it's not that hard to find them. But they said, unless it's one of those 2 sources, any other CBD product is going to be considered misbranded and therefore adulterated. So, and they even stated like you risk your license and your pharmacy license. So, you know, just understanding the liability that some people face. I think about the programs like that don't even have medical cannabis available in any capacity, and that just boggles my mind. Victoria, we haven't heard from you in a while. What are you thinking?
Because I have no idea.
Victoria, I'm so sorry. I think I had you muted. That was my bad.
Oh, it's okay. I was thinking that I don't, I have a problem with a lot of the CBD companies that are out there. And a lot of the over-the-counter stuff that you see like at Rite Aids and CVS's, I don't know what that stuff is. I don't know if it's been tested. So I don't recommend things unless they come out of a dispensary in Oregon or Washington, because why wouldn't I, you know, I'd rather get a product that I know has been tested, that I know has gone through some more rigorous hoops to get onto the market. And I was just thinking of that pharmacist who recommended that. There's so many of these companies now that people are jumping on. Anyone is jumping on the bandwagon to make money on CBD with some of these products, and they have no idea what they're talking about. And I don't know if it'll be damaging. I don't think it's probably damaging. I think some of the products might be okay, but it's definitely a little bit disturbing to see a lot of these products out and about and being, you know, told as being a miracle drug. And you don't even know how it was extracted or what else is in there. So that's just my 2 cents. I just generally don't recommend any of that stuff. But I think it should be available to everybody. So it's difficult. It's kind of my professional opinion versus, like you said, your professional opinion versus your personal opinion. It's just very conflicted sometimes with this stuff.
And, you know, that's coming from people that are physically recommending this to cannabis, you know, are physically recommending cannabis to patients daily. You know, imagine pharmacists or other healthcare professionals that, you know, don't have that one-on-one direct experience where they can physically see how cannabis is changing their lives. You know, it's very easy to understand why there's discord and distrust in the industry. You know, it's kind of set up that way. I get questions all the time. What's the difference between hemp and CBD? And it's just like marketing.
Yeah.
No, I mean, there are some differences, I think, but it does come down to a marketing. You know, what are you selling? Are you selling the hemp seed oil, or are you selling CBD in a quantified milligram concentration? And what you give, you know, you want it to be patient friendly. Let's see. So there was a question. I don't know how well our panelists can answer it, but it says, what happens to pharmacists in medical dispensaries when they go recreational? And I'd feel comfortable answering that. I think a few states are looking at it. So New York has always been talking about recreational or adult use cannabis. So and they do require pharmacists in their dispensaries. So I would see them as being the first to make that change. Do they get rid of pharmacists? Do they allow their medical program to coexist with the recreational? There's a lot of money involved, and I feel like that is what's going to determine what happens. But pharmacists are expensive, and you know, a pharmacist's salary is expensive, and not everybody that goes to the dispensary will require those additional clinical pearls or recommendations or advice, whatever it may be. How do you, Kareem or Victoria or both, have you ever had a patient just not reach back out to you and you felt like you had to go make that extra step in order to get them engaged?
It happens all the time. I ask people to tell me either way whether it worked or if it didn't work, to get some feedback, and people disappear, unfortunately.
Yes.
I found that once I started charging for my services, that the people that had paid money for it are more engaged because they find a high value in it. I still do a lot of pro bono work. But sometimes it's very difficult to get people to get back in touch. And sometimes I don't want to get back into the Pandora's box, honestly. If there's a lot of very complex cases out there, a lot of people that want the cannabis to cure everything. And sometimes I think I might tell them maybe something that they don't want to hear, and I'm able to help them with a few of their, ailments, but not everything. It's a little bit frustrating, I think, for patients to come to the reality that, maybe they're not going to be able to stop their blood pressure medicine and their metformin and everything else. They think it's going to take care of everything. So sometimes you're just giving them the truth, and it might not be what they want to hear. But for the most part, with my new business and the way I have it set up, they're allowed to have a free follow-up phone call if they want it, and they can also email me as much as they want. So when I set it up that way, I feel like I'm getting, they paid for it, so they feel like, oh, I want to get the most out of my money, so I'm going to keep checking in with Victoria. So it's been a little bit better with the way I've done my business model.
Yeah, and
Kareem? Oh. Kareem, you started and then you stopped, so I wasn't sure if you were just really agreeing or.
Oh, sorry. No. So yeah, and I would totally agree. Just going back to like what we were saying with regard to like all the commercials and whatever else, like, yeah, a big part of the expectations are a result of the market, right? Like people are seeing all of these ads everywhere, and CVS is carrying CBD now, and CVS is all about healthcare, right? So it's like people have these crazy expectations, and it's almost like with psych medicine too, where it's like, okay, well, I've been on Zoloft for 3 days and I'm not better. You know what I mean? So it's like, it might not necessarily be that quick of a time frame for you to actually feel symptom relief, right? So like, depending on what it is you're treating, it might take a little bit of time, and it might take some time to figure out what the appropriate dose is. And it does require some massaging. So some people have the tolerance and the threshold to be able to handle that. Some people don't. So yeah, for sure, as far as patient drop-off goes, definitely it's a real thing. It's a real thing the same way it is with regular medications, whether it's somebody's lisinopril or whatever, right? Like there's always that challenge to try and explain the value and get the patients to understand that value, and to kind of be committed to it for some period of time until they actually determine whether or not it is actually appropriate for them or working for them.
Awesome.
And I did also just want to touch up on one of the previous questions. So somebody had asked about like the job postings and things like that. So one thing that I will recommend, or I'll strongly suggest, is that don't wait for job postings. Look for needs. Look for where there's a deficiency, where there's a need, and create your own job, right? Like if you're in a state, so for example, like this is actually something I'm actively pursuing right now as well, which is trying to get a relationship established with the local dispensaries. So in Massachusetts, they don't require pharmacists. Should they be there? I think it would make a lot of sense. Trying to get the legislation changed, that's going to be a big uphill battle that will take years and years, right? So instead, what I'm trying to do is approach it so from the side where it's in their best interest to have a pharmacist involved, whether that be on site or whether that be via teleconference or something of that nature. Because yeah, a lot of patients will go in, they'll pick up their product and they'll leave, but then those other patients that have questions a lot of times they have a lot of questions, and they're there at the counter for sometimes half an hour, 45 minutes, or an hour, right? That's a single patient. And now there's a bunch of other patients not getting treated because this bud tender is trying to provide a consultation, right? So as a result, you could potentially help redirect some of that that time to you instead, as the medical professional, to be able to provide that clinical consultation, to free up those bud tenders to do what they should ideally be doing, right? Which is getting people cashed out, right? So I would definitely suggest, like, don't wait for jobs. If you're motivated and this is something you're passionate about, look for needs and then create your job.
I definitely agree with that. And I had something come up just recently. I live part-time in California, and there was a really beautiful new dispensary that opened up, and I went down there to talk to them about helping them out with some of their clients, and maybe doing some days where I could come in and talk with people and help guide them through the store. And they really did not see any value in having me do that. They feel like their bud tenders were so well trained that they don't need me. And I said, fine, no big deal. I didn't worry too much about it. And I came back after one of their opening days and overheard a conversation with the bud tender and a patient that had rheumatoid arthritis. And I spoke to the owner afterwards, and I said, I hate to tell you, but your bud tender doesn't realize that there's a difference between regular arthritis, osteoarthritis, and rheumatoid arthritis. And I think that if you would have had some other training or had a pharmacist in there, not only would you have sold more, but you would have had a happy patient that comes back again and buys more stuff. But now that patient was sent out the door with something that's subpar. It's not going to work, and they're not going to come back. So I was able to create a little bit of dialogue just by watching the interactions that are going on in that dispensary. And I think it was powerful for them to kind of rethink what they need there. And their bud tenders are not medical professionals. So there's certain things that they're just not going to be able to understand.
Yeah, I agree. And I feel like that's a big liability on their end. And I feel like as soon as you start talking about that word liability, where you have, I mean, let's talk about the definition of a medicine, right? And what qualifies. And I think we can all agree that cannabis is a medicine, right? And who's supposed to be involved with the dispensing and the consultation of medication? That's us, right? That's not bud tenders. We had to go through 6 years worth of, or however many years worth of training to get this degree, to go through all these tests, to do our continuing education on a regular basis, to be able to hold that title. And to say that, okay, you're, like, I'm not even joking when I say that my first experience with a bud tender, it was with somebody who was valeting cars 2 weeks prior, so it's like, yeah, what experience, what knowledge do they have, A, about cannabis, and then aside from their, street knowledge, and then B, about any medical condition. And this was like a young, maybe 20-year-old, so it's like, it's challenging. It's definitely a struggle for sure. But if you kind of introduce the different things to think about, like liability, like, actual throughput at a dispensary and things like that, you start to speak their language, then they're definitely more willing to have that conversation with you.
What do you see the role for pharmacists in the future for the cannabis industry?
I see it as being, well, I'm hoping actually that many of the states, once it goes federal, will consider doing the same thing that some of the other states are doing and having a pharmacist on board at least a few days out of the week. I think that should be something that's considered across the board. So I'm hoping that we're going to see more pharmacists in dispensaries, pharmacists as educators to the doctors, because I think the doctors are overwhelmed by the information that's out there on cannabis, and they have no idea. Most doctors really don't even know where to start, don't have any idea, know it might be helpful. So I see jobs in educating physicians and on cannabis. And I also hope there'll be specialty physicians physicians, because there's such a plethora of information for cannabis for so many different health conditions that we might see pharmacists in as a cannabis pharmacist, and then in certain specialties.
I would love that. Let's get a board certified cannabis specialty.
We're working on it. We're
Yeah.
actually, partnering with ASCP, the American Society of Consultant Pharmacists, and they're the ones that created the board certification for geriatrics as a specialty, and they sold it to BPS. So I'm hoping they take me under their wing so we can figure out, I think the name we're kind of shooting back and forth is a clinical cannabis consultant, or something. I like alliteration, so sue me, but just having it be something that you could put behind your name, and it signifies that you've reached a certain level. And I've been kind of peeking at who's in this call, so all of our participants joining us are all members as well. So we are going to start that process for the certification. It's going to be a course, but the certification actually comes from the examination, and it's going to be a pool of questions. I think we decided on, oh Lord, like 120, 100 of which are included in the score. That way we have some flexibility and curving it if needed. But it's really exciting to see people come together and truly advocate for some standardization in this industry, because that's what we're used to. We're used to our very clear-cut dosing guidelines and algorithms where you just follow the flow chart. And when it comes to cannabis, and you have so many different symptoms that you can treat, and patients coming in with all these complicated medical conditions and medications, and they've always got a ton of allergies. it really forces us to really be creative with our recommendations and listening to our patients, what their goals of therapy are, and how we can get them there. It all starts from that relationship. Let's see here. Do you guys have a favorite product you recommend? You don't have to give the name if you don't want to, but I'm kind of looking like, I have some pharmacists I work with, they will only, and I mean only, recommend capsules because they prefer capsules compared to our vaporizers or oral liquids. I have some pharmacists that I try to give every one of my first patients a vaporizer because I want them to have something that works right away, so that it kind of eliminates that fear of, oh my God, what is this going to feel like?
Yeah.
I love tinctures. I use a lot of tinctures. They're easy to dispense. They're easy to dose. I just like them. That's what I use.
Victoria, what's your Instagram handle?
It's Sage Life for Health.
I love it. Yeah, you post about a lot of tinctures, so I could have guessed that.
Yeah.
Kareem, what about you? Do you have a favorite?
So for me, if I try to steer away from edibles sometimes if people are not familiar, like if they're naive, I'll try to kind of leave that as like a later option, just because with edibles, more often than not, I've found that people have a hard time managing that delayed onset and that extended duration. So that's part of the reason why I'll recommend something like a vaporizer. But the challenge with the vaporizers is that dosing becomes a little bit tricky because you're talking about, different pens produce different wattages and amps and whatever else, and depending on the duration of which they're actually pulling and things like that, it can get a little bit tricky. So yeah, I mean, I would agree. I think tinctures are definitely great. Granted, it depends also on how they're using them. If it's buccally or something like that, you might get a little bit quicker onset and shorter duration. But yeah, I mean, I think I would say not necessarily a big advocate for one particular product, given the myriad symptoms and circumstances that are usually at play. But if possible, if a patient can use something that isn't necessarily like an edible type of product, then I'll typically go with something like that.
Do you have a favorite chemo? So I should probably preface this and say our committees got together in conjunction with ISMP and the University of the Sciences Substance Use Disorder Institute. And we developed a baseline policy for labeling, because this is like our first step for standardization. We want all of the products in this country, ideally the world, to be labeled similarly in a way that any provider could look at it and get the most valuable information they need in a timely fashion. So one thing that we actually recommended, we kind of recommended 4, but the ISMP was really against it, was the ratios, because you never know which component is first. And especially when we talked about, oh, well, you know, THC and CBD is important, but what if we get to a time where there's other cannabinoids like CBN and CBG, and those are on the label as well, and they're standardized to a ratio? Like, how do you standardize that ratio? So for now, we are just going to stick to 3 words, or 3 different categories: THC dominant, balanced, or CBD dominant. So of those 3, is there a go-to that you find is most effective for most of your patients, or something along those lines?
CBD dominant for me.
Very nice. Kareem?
Definitely.
Yeah, I would say in a majority of cases, probably CBD dominant.
You guys aren't living. I'm just kidding.
I never said personal cases.
I actually find that, and the state of Minnesota publishes data, so we can see what most people are buying. And like, I know for pain specifically in Minnesota, we call it intractable pain. So it's either pain that does not respond to ordinary methods, or there's some type of contraindication to not allow the use of opiates or some other type of pain medicine. And I think it was 72, 73, somewhere there, percent of patients had something THC dominant, whether it was pills, whether it was a liquid, or whether it was a vaporizer. This did come out before we got our topicals, so before we got our creams and our lotions, yada yada. But just seeing that most of our pain patients were gravitating towards THC, and, you know, making that comparison that, you know, everything is mind altering. You know, sugar is mind altering. That doesn't necessarily make it bad, although I'm sure we could argue that sugar is bad. Let's see. Any other questions for our presenters? I know they're doing a fabulous job here, and I know their time is valuable, especially when one of them's on the East Coast and one of them's on the West Coast. All right, guys. So we will be publishing this recording. We're going to post it to our YouTube, and then it'll also be linked to our website. You should be able to go into our website and see exactly, based on the type of post it is, whether it's a journal club, whether it's inside the Canna industry. And then our next series is the patient case reports. So this is where we look at single patient cases, and we discuss and dissect really what thinking was going on when we made those recommendations, the actual responses from patients. And we're still debating if we're going to have patients join us for that one. We've had kind of a mixed response from our committees. I'm against it. I think we should kind of stick to pharmacists, because sometimes it can be awkward if you're talking about someone. But at the same time, you know, if there was a positive result, it's cool to hear that from the patient. And I'm sure Kareem and Victoria can attest to that. So thank you everyone for tuning in, and I hope you all have a beautiful rest of your evening.
Thank you guys so much.
Thank you. Thank you.